today is we're going to keep it relatively conversational. So we're going to we've got a few kind of questions and areas that we want to explore, but as Nikki said, we want it to be as interactive as possible. So please just make use of the chat box and put any questions, thoughts, feedback that you have, and then we'll build that in as part of the conversation and use that as stimuli. We've also got a short Q&A at the end of the session. So
play Q Radio Belfast.
Oh, I think we've just, if everyone wouldn't mind putting themselves on mute, that would be really, really helpful. So we will do a short Q&A at the end as well, just to wrap up anything that's coming through. So we're going to kick off with the first question, which is around what is digital workforce. We did a survey across members just to gain some insights and around what the understanding of digital workforce is, the digital maturity across organisations, and where digital fits in at the moment across your people agenda. And one of the things that came out was quite a mixed level. So we thought, let's kick it off by just talking about what digital workforce is and why it matters. So Claire, can I come to you first? And if you would like to just do any more of an introduction to what Nikki has done, then please feel free.
Thank you very much. Good morning, everyone. Nice to see you all. So my title is Director of the Future of NHS HR and OD, which my role stems from the report, which I'm sure you all saw in which was published in November 2021, and that has got a number of themes, and I particularly oversee what are known as the enabling themes. So around transforming people's services. So many of you may be aware that we've been looking at some work around scaling, but very closely linked to that is embedding digital solutions. And so I look after the people digital team, and we're working closely to try and transform people's services by increasing the use of automation, AI, robotics, actually, so that we can release our colleagues, our own staff's time to focus on more value added, and at the end of the day, releasing time for our staff to care for patients. So that is sort of what our aim is. And prior to coming to NHS England last June, moving to the dark side, as they say, I was actually a CPO for about 13 years into London Trust. So I've sort of been there on the shop floor, so hopefully sort of understand some of the challenges that we all have. So Hannah, did you want me to move over to the first question around what I think of a digital workforce is? So I think I think there's a couple of definitions. I think there's a purist definition, which is really sort of the utilization of software robots working alongside employees to undertake basic tasks. So, you know, that can be from anything, if I use an HR example, from a leavers process. So that's automated, releasing the time of our HR staff to do something, to actually in, you know, a more complex environment is where a clinician is utilizing AI to diagnose patients. So there's a huge spectrum of what a digital workforce can look like. But I also think we can look at what a digitally enabled workforce looks like. And that really is about all of our staff colleagues being actually having the tools to do the job in terms of all of the robotics, automation, but also having the skills. And I think that is obviously an area where we need to focus on, and we'll probably come on to that in a discussion. And it is, and why it matters is that I think, you know, in all of our lives, we're so used to, you know, contacting the bank, doing lots of things remotely, paying for services. But when we come to the workplace, we quite often find that we don't have We have to, systems aren't interoperable. We're still, asking patients to actually come into a hospital setting, overcrowding, and that patient and customer experience is quite poor. So the more we can use robotics, automation to streamline our own processes, release that time for our staff to care, but also for our patients. More and more in the future, patients will be cared for in their own homes, which will actually, again, release our staff's time. And we know that's critical given the workforce shortages. It's also has its benefits in terms of accuracy, timeliness. Bots work 24/7. We've seen in some HR functions where they've introduced bots, staff really like it because, if they're working a night shift, they can actually do some of the tasks that they couldn't normally do because the HR team aren't there, for example. So I think there's huge opportunities and benefits, not only to the HR community, but to our staff for having a sort of a digital workforce that works alongside us.
That's brilliant. Thank you, Claire. Really great way to kind of kick us off. Liz, Janet, Ray.
For somebody else.
No, you go, Liz, you go.
So I think that was brilliant, Claire, and really sort of summarises what this is about. So what I'm going to say is going to complement what Claire said, hopefully, in the if we can sort of help our wider workforce to embrace digital, to be curious about it, like Claire says, to use it like they would in their everyday lives, to think about things differently as chief people officers and people in the people profession, connect with people who are digital innovators. I think that really helps us to build up this capability in our workforce that they want to use digital. If we've got digital solutions that we can see that are in our organisations that will really benefit residents and staff, support them to embrace that. And my background, I went from being chief people officer, I was in an ambulance trust, a mental health trust, an acute trust, and I went to be a trust chief exec in a very innovative trust. And it was fantastic actually about what the clinicians and staff were doing. And the job there was to connect all these things up and get people working together. I then moved into an academic health science network and looked at lots of digital innovation and really promoted the ones that would help residents and staff to do the best in their jobs or get the best out of their health and care. So if we as people professionals can model that ourselves by some tools that Claire's talked about, so we've got that digital workforce in our own team, and then support the wider workforce to do that. And I often find that the best digital innovations might be really complicated behind the scenes, but they're really straightforward for staff to use, so it's just easy to embrace. I think that's how we start to develop that culture of people feeling curious and wanting to develop the capacity and capability to be a truly digital workforce. And I think, Janet, you were coming in at the same time as me, weren't you?
I was, yeah, trying to make it look as if we're actually sat around a table at the moment.
Health section in your Alexa app.
Somebody else not on mute as well. Oh, okay, so yeah, as Hannah said at the beginning, I'm Janet Wilkinson. I'm currently Chief People Officer at NHS Greater Manchester Integrated Care. I actually joined the health service back in 1986, so 37 years ago, and we didn't even have computers. So I do feel a bit of a fraud being here today. Yeah, no computer, I had a typewriter and copy paper. I've worked in a variety of different provider settings, and obviously the ICBs are new, so this is a new role. I'm not a digital expert in any shape or form. My team actually laughed when I told them what I was doing today, which I thought was a little unkind. I'm hoping I can learn from the conversation as well. So in terms of what does digital workforce mean to me, for me, it's about speed, it's about efficiency, it's about accessibility. I do think it's a great equaliser when we're operating in the digital world. There are huge variations in digital confidence across our workforce, which we need to recognise. but it is the way we live our lives now. So whilst my team might have laughed at me, I do live the rest of my life online. I do all my shopping online, I do all my banking online, everything else that, you know, the rest of us do as well. So I think, and also as a leader, it does enable us to actually investigate the data much better. And that is a, you know, a huge problem for us in the people profession, is that we don't always have really good data around our people. And, you know, I've recently, we've recently run some recruitment fairs, and the recruitment fairs themselves, face-to-face events, getting people on board, brilliant. But then actually the onboarding process, a lot of which is digitized, but in lots of different ways, has been extremely challenging for people. So for me, it's the way we, you know, we want to be. I want to learn. I think we need to be more curious, as Liz said, and be prepared to take risks on things. So thank you. Good to be here.
Thanks so much, Janet. And I think it's thanks for saying about where you're, almost kind of your background and kind of where you feel you're at the moment with digital, because I think it does just reflect that we're coming to this from different starting points within kind of different organizational contexts, and confidence in ourselves and kind of understanding of the digital landscape. So that's really helpful to share. Thank you. Ray, any points from you?
Yeah, the first point is Olivia Shaw, you've got a beautiful child. She made a brief appearance. I saw her pop up, so she's welcome back. I'm assuming it is a girl. She's welcome back anytime. So hi everybody, my name is Ray Pendleton. I was an OD director in Aintree University Hospitals until about 2014. So that's up in Liverpool, if you haven't spotted the accent already. And I guess my take on digital was the reason why I left the NHS to pursue what we're doing now, which is the product work, Paul. I think what data provides for us as an opportunity for healthcare management professionals is an opportunity to really grab real-time workforce data in all manners, recruitment, exit, performance, whatever, and really utilize that data to make better decisions. And I'll be brutal in terms of my experience when I was in the NHS. I was kind of seen as the kind of board, as the pink and fluffy guy who did talent and leadership and all that kind of stuff, with no real grip on the organizational data to make an impact strategically. And the reason why I left was I thought through digital we could actually do that. We sit here today doing that kind of work every day. But I think in terms of the healthcare management professional side of things, I think it also presents us with challenges about upskilling and new skills, obviously, and getting to grips with where we need to be as a profession in the next, 5-10 years in order to really take advantage of digital and being brave enough to step into that space. So that's kind of where I am with digital, Hannah.
That's great, thank you. Something that's kind of really resonates with me from what you've all said is the influence of tech around culture and ways of working in organizations, so around connections and speed and accessibility and different ways of working. And I'm keen to get your thoughts around how, in your experience, you've seen digital and technology influence culture, and what's that meant from an organizational perspective in terms of employee experience and productivity and efficiency. What are your thoughts around that? Jump in as you will.
Can I come in on
Yeah,
that?
please do, Liz. Yeah.
So working in the Innovation Agency of the Academic Health Science Network for the North West Coast, we covered 22, it went down to 21 because we had merged 21 trusts. And the features of the trust that were really good at deploying digital. I'm going to quote loads of Steve's here, actually. I like Janet's say about confidence to engage in digital. So I think that the trust that did really well and did engage the workforce helped them to think differently. We talked about curiosity. People were genuinely interested about, what's going to make a difference to our patients or our service users' lives here? What can we do? And they would sort of look around and see what was going on. There was something about connecting those people. So if you've got like a core staff group who are really enthusiastic to do some of these things, to work with colleagues, they connected them together. So they were very good at like forming a little team. Because sometimes, as we know, if you're introducing something new, it's really difficult and you need some support around you to be able to do that and just bounce things off people. And they connect outside of the organisation as well, saying, what trust is doing this? A bit like HPMA. got somebody to come to, and you can talk to, you can say, are you doing anything in this space? And then they start to catalyse and sort of accelerate digital because of that, because people were seeing other people doing it. They felt a bit more confident that the organisation was going to support them. And then that sort of led to this cultural shift. And for us as an HSN, it was brilliant. You could see some of these, and we worked with them, but you could see some of these organisations doing really well. And we could say, oh, could you be an example? Can we and obviously celebrate what you've done, so that if somebody has done something really well, they've introduced something digitally that would help staff, would help residents, you've got that acknowledgement going on to just move that forward. So I think there was some sort of key features that we can all try to replicate in our organisations, can't we? Even if we're in like a really tough organisation, you'll normally be able to sort of pick some people out who are doing great things, match them with somebody else, help people to feel confident and shout about it. Even if that's in a small way, you can get things moving. And I do think that there has been, Jeanette's put a really important message in the chat about, by using digital, we can't cut people out. So we have to be really conscious that digital works for some people, that for others, if it's staff, they might need additional training, they might need different devices. And some people, like somebody who's shaking hands using an app, that's really difficult. We might need to think about other ways of doing it. But I think those organisations that embrace this also embrace the differences in staff members and service users.
And I completely agree, Liz, and a couple of other things I think that have shifted it. I think we've talked about it in lots of other ways, but certainly the impact of COVID on our ability and the way that we live our work lives has changed considerably. Whereas we might have got things signed before we met in person, people have become more familiar with using digital. And the other thing is the expectations of staff. I mean, I think particularly when we're talking about recruitment, people are very used to a much more agile way of onboarding in other organisations, and that has a significant impact on us in the NHS and our inability to do things in a particularly efficient and speedy way. So in view of the current, recruitment issues that we've got, I think it's really important that we do continue with the things like the time to hire programme, and obviously working towards the son or daughter of ESR. Then we do need to think about that onboarding process particularly, and how it feeds into growing expectations from the workforce.
I'll come in and just to I think COVID, whilst obviously a devastating impact, I think if there was a positive impact, I think it was team working and the increased use of digital tools. And I know I was in a trust at the time in London, which had a very diverse population. 67% of the community and our staff were from Black and Asian minority ethnic groups. And so we were really hit hard. And so in terms of the hundreds of languages that were spoken, communicating with our patients was really important. So we used digital means to communicate in lots of, and the ability was a touch of a button, you could put out different messages to patients in hundreds of different languages. You wouldn't have been able to do that, years ago. And so, I think it is good for our staff. It's also good for our patients in terms of how we can access and, to Jeanette's point she makes, you do need, and Janet said this as well, you need to have a variety of different ways in which people can access. And I will also, reinforce what Janet says. Our recruitment processes are so poor. We expect people to fill in pages and pages of application forms. So if you've got any sort of learning disability, or English isn't your first language, we make it really difficult. But I saw a couple of weeks ago a bot, a fantastic recruitment bot, which I'd quite like to showcase at some point. It speaks 32 different languages. It even uses sort of terms, it is like talking to a person, and it can change its sort of tone or whatever depending on the person. So it's really intuitive. and it makes the process so much better. You know, this nurse had an interview booked within 10 minutes. But what we do need to do, as Janet says, once we've got that person, we've offered them a job, the rest of the process needs to be as seamless. I think I was talking to KPMG recently, and they did some research on 4 trusts, and 23% of candidates drop out during that recruitment process due to the length of time. I'm just going to give a bit of a plug for the Futures work, because we have actually taken 15 use case journeys. So if you took one as recruitment, we have gone through it and looked at where you could simplify the process, where you could automate the process, and those will be available on the Futures platform in a couple of weeks' time. So trusts don't have to repeat. We've done all of these journeys, temporary staffing, that you can pick up and utilize in your own organizations, and hopefully that will help you streamline your recruitment processes.
That's really great to hear, Claire, and I think certainly some of the feedback that I get from clients and contacts across the NHS is sometimes not knowing where to start. And I think through this kind of conversation, it's clear that we're talking about a big and a large and a complex, knotty agenda. And for some people that may feel, I just don't know where to start and kind of what that looks like. So I think having something that really allows people, gives people maybe a roadmap of the things to be thinking of, I think is going to be really helpful. And just one thing I wanted to bring in, and it's just prompted by Rich, who made a comment in the chat box around using a chat bot for recruitment and in terms of kind of interview questions. And I think just a really good example of how you can start quite small and kind of test and kind of trial different things and just experiment of kind of what are some of these tools that are available that help to progress the digital agenda within a people space within an organization. Doesn't have to necessarily kind of be the all of the kind of the big stuff all at the same time, but actually how can we kind of start to make some movement? And linking back a little bit, Liz, to your point around this kind of ripple effect around how you start something, build confidence, and how that then acts as a catalyst for further change in the organisation.
So could I just add, Hannah, and I think it's really important that we don't just jump to automating what we've already got. I think it's, from what I've seen both inside and external to the NHS, is that you really need to simplify, standardise, and then automate. So you really need to do that. And hopefully the processes I mentioned will start that journey for people, because don't just automate what you've already got now, because if it doesn't work now, automating it won't necessarily make it any better for our staff or for our customers or other people. Sorry, my dog's just come back from a walk and is now jumping all over me. Sorry. The joys of working from home.
It is, absolutely. Just on that point, and then I think, Ray, you want to come in. It's I think it's this important distinction, isn't it, between digital and digitalization, and that from a latter perspective, it's around how you don't just automate, but you really kind of transform the way that you do something, and that where it really links into the cultural aspect of it around what are we, how can tech enable a different way of working, and it's a really helpful point, Claire, to make, because that's really kind of the mindset, I guess, around tech, particularly in a people space. Ray, did you want to come in? Yeah,
it's a slight anecdote, but it builds on the points that have been made around. Yeah, let's not replicate what we've done in the digital form. Let's take a step to think about the transformational effect on these things. I'll share a very quick story where I was presenting to an exec team, and we worked with this exec team for a number of weeks, months, about what digital could mean. How are we creating an intelligent executive team that can treat and think about HR and OD differently, because the digital aspect we are taking will not only elevate but accelerate what we can do for the organization in a business sense. So we're talking to this team, and after a while, and Liz and Hannah know what I'm like, so they'll probably smile at this, I hope. But I did turn around and say, look, if I was Henry Ford, who'd just driven a car into this boardroom, all you've been asking me is, where's the horse going to sit? we're liberating the horse, so you can use a car instead. So the horse is gone, the car will get you to the same destination the horse did, but faster, quicker, and all these kind of things. And it was a slight analogy that probably went down better than it did on here. But it was making the point that there are changes to be made, not just digitalizing stuff, but actually taking a step back and saying, what can digital give us in a different aspect by reviewing things before we digitize. I'll put one more point on that, which is around, if as a profession we're waiting for products to come out there to us, that will happen, because I get contacted quite a lot by people who are entering the digital space of workforce to talk to me about the NHS and what I know. So I know that the marketplace has got continually people coming forward. I would just say, in my own experience, my own journey, the innovation we built and continue to develop with clients came from the NHS. And I think it's an opportunity for us to also, as people, professionals, to think about stuff. Richard's example is brilliant. Go on ChatGPT, create some questions. I think we can do things ourselves and generate excitement and innovation from within, not just wait for the market to come to us with solutions. I think that's a really massive opportunity. Thanks, Helen.
That's great. I wonder whether it's worth us to focus around a little bit about kind of organisations that want to become more digital. What should they consider? We've kind of talked about these, some of the kind of the different ways that people can approach it and the different things that kind of people can think about. But what are your thoughts around? So if we've got interest is peaking within the audience that we've got this morning, and thinking what is it that what are some of the first steps that I can take? What would some of your advice be around that?
I think for me, I'm also in that boat. I mean, we've just merged 12 organisations into one in the ICB, and we've got lots of different systems or lack of systems. So what we're starting to do is starting to scope out the environment, what the opportunities are. We're certainly going to be linking in with the HR Futures programme. We've got meetings set up with people who've been doing this. I think whilst it's a significant challenge at the moment, I haven't got good data. There's 2,000 staff in our ICB and I haven't got good data. So it's starting to understand that. What we're also going to be doing is seeking some investment. I do think I know we probably might talk about the barriers later, but we have to be prepared to put some investment into this area. And the other thing that we're doing is looking to identify digital champions within the team. Because I think, going back to Liz's points earlier, it's really important that we've got people driving this from the inside. So those are just some of the things that we're doing at the moment.
Can I add to that, Hannah, as well? Because I think that's like putting all those processes in place, you get things going, you get a structure, and I think it is really vital to have a good team around you to start to implement things. So coming back to Claire's point, to implement digital properly, you need to look at your processes, so you need a team to do that. You need to build in more time, I think, than you ever thought it would take, because there'll be people raising queries, there'll be things might go wrong, funding might get stopped. We know we're on funding cycles, so I put a good amount of time aside to devote to this, and also sort of think about your evaluation. So if you're putting something into practice, you've got the team around you, you found the right solution that meets the need, how do you at sort of set points evaluate that what you're doing is getting the right outcome? So don't leave it till the end to say, how did we do? But along the process, be thinking, did that have the right effect? Do we need to tweak this? I think somebody said to me the other day, do we need to pause, persevere, or pivot? And just make sure you've got those processes in place when you're implementing your solutions with your team and you've got good communication going on.
So I concur with colleagues. I would like to sort of reinforce Liz's point is, I've been involved in developing a collaborative bank in my previous ICS. And everyone was doing it on top of their day job. And it just took forever to, we got there in the end, but because it was on top of everybody's day job, it just takes so much longer. So I'm sorry to plug Futures again, but we're developing a scaling guide, and many people have been involved in that, but which is 200 pages long. Which is really for HR teams, and there's a section on there which talks about automation. So we're just finalising, again, that will be on the futures. But what we have done is develop what we're calling a strategic guide to scaling. And Janet's probably heard me talking about this so many times, so I'm sorry, Janet. But that strategic guide is a much shorter version, about 18 pages, which will, again, we're launching starting on the 15th of May. And that strategic guide is aimed at CPOs, but also CEOs and CFOs to make the case for change. And it reinforces in there about you need to put resources behind this. People can't do it on the, on top of their day job, and you will need a team of people to do this. And actually, the investment is worth it in terms of productivity, quality, benefits to everybody. So we're sort of hopefully supporting our HR community by getting the CFOs and CEOs on board with this, because I think it's really important that you do have that backing, and hopefully this guide, which we will be sending copies to all of that community, will help reinforce that message and help you and actually along this transformation journey.
Can I just add something there, Hannah, as well? I think, and Claire, obviously, I when I can attend the HRD advisory meeting, and we've talked, haven't we, there about how we can make all these resources accessible, to the people profession, because there's obviously a lot of interest, isn't there, around that. And I think somebody's just asked while you were talking if you could drop a link in to the Future Centre in the chat. I don't know whether that's possible or not. But I think it's great to see that these are the people, those of you that are asking those questions are the people that are going to drive this change, not necessarily just the CPOs, the CEOs and the CFOs. So really important that we engage with everybody.
If I could just add to that, as the kind of gamekeeper turned poacher, ex-NHS and now delivering digital back to the NHS. So I welcome that, Claire, in terms of that guy was really helpful, because I know while Hannah this morning is in the guise of facilitator and coordinator, she actually deals with a lot of our clients in the company, and I know Hannah works incredibly hard with NHS clients and partners to help them through that change journey. It's a difficult one. I'll actually put you on the spot a bit now, Hannah, rather than letting us talk. It's a little bit. It's sometimes a challenge, isn't it, Hannah, in terms of helping people along that path? Yeah,
definitely, and I think it's. I think as Liz pointed out, it's digital can often be seen as on top of everything else, and therefore it's very hard. And I think we recognise the benefits that digital provides, but with the context as it is in the NHS at the moment, incredibly complex, incredibly challenging, then some of these more kind of longer term transformational programmes get put on the back burner. So I think doing something where it's really putting it at the forefront and having that backing is really important. We know that there's been loads of digital transformation that's happened in terms of patient services across the NHS, and it's brilliant that this is now coming through more in the sense of how do we kind of give out, enable, empower, provide the right kind of tools and capability for our people to mean that they can deliver these services in a different way as well. It sounds like you're doing amazing work, Claire, and I think resources that are really going to help people to be able to move this agenda forward. In terms of, Janet, you touched on barriers, and I think that's really important. We've talked a lot about almost kind of the rhetoric of why this is really important, and Claire, you and your team are providing lots of interventions to be able to help people to be able to move this forward, and we've therefore touched upon some of those barriers around financial investment, capacity, the need to really be able to devote to this. Is there anything else through your lived experience around this which you would say is a barrier? And actually, it would be really great to kind of have people's feedback on this. You're working in this, kind of what are some of the barriers that you're facing, because that's the reality, isn't it, of the kind of the world that we're living in, and what's kind of stopping us being able to kind of move into the space that we need to.
I suppose for me,
skills,
the one. Sorry, go on. No, you go first, Claire.
Yeah, I think it's the skill set. You know, Janet was joking about her skill set, and I'm probably the same. Although I was a computer programmer many years ago for the Met Police, so, and I used to write the programs for the crime stats. So don't believe any crime stats from about 30 years ago, because they're probably inaccurate, but but that is the limit. But on a serious note, I do think there's I think people aren't confident generally. You tend in your HR teams to have a few people who've got this skill, and we're always reliant upon our sort of ICT teams to come in and do this. And if it's not their priority, you know, we're quite often down, you know, the scale in terms of that. So I think we need to upskill our own HR profession. And I know obviously the HPMA, Hannah and Ray, you're working on developing a program, and you will also know from the people profession map, there is one of the competencies is around digital. And so, you know, and there will be an assessment tool, which again is being launched, I think, on the International HR Day, which will help people assess where they individually are against the various competencies. And so we're looking in the future with HPMA, CIPD, as developing an accredited program around the digital agenda to really try and upskill our workforce. And also at a national level, they recognise there is a lack of skills, not only within HR, but in the workforce generally, and how important that is going to be. I'm part of a group that is developing a digital workforce strategy for the future. They reckon by 2030, we're going to need another 10,500 digital people within and the NHS, and that is a huge agenda, especially when we're competing with lots of other tech companies. So how do we grow our own? So again, at a national level, they will be developing programs to upskill, you know, clinicians and non-clinicians. You know, that I didn't even know that there's a clinical informatics apparently is, you know, and going to your point, Liz, about data, they're really trying to upskill, and I think we need to do the same for our own profession. So we've got people embedded in our teams that can do this, and we're not reliant upon other people doing it.
I'd completely agree, Claire. I think the other one that I was just going to make reference to, and I don't know how significant it is, but I do think as a people profession, there are those amongst us who have an innate kind of distrust of anything that doesn't mean dealing directly with people. I think, you know, we need to kind of recognise that. There's also a bit of a fear that, you know, this is a precursor to shared services, and you know, bearing in mind the scaling up, and I think it is about how we do that. You know, I was a member of the board of the NHS Wales shared services, and a lot of that was clearly built around digital systems because of the geography of Wales, and it probably took 2 or 3 years to actually get ready to implement that, and it was a much more positive experience than I think some people have had of just piling everything into a shared services and then digitizing. It is important that we think about the interoperability, I've learned that word, and how our systems kind of join together before we do that. But I do think as a people profession, there's something about our need to interact with people rather than bots that also needs to be overcome, as well as the upskilling. Thanks.
And I think just to add to that, Hannah, so one of the things here we've talked about is that this takes quite a long time. You've got to be prepared and have time. And I think as people professionals, we're quite tenacious. We know we're always dealing with grey rather than black and white, and when we've got to sort of work our way through things and connect things and think about how we do that. So I think the people profession are in a really good space to champion some of this for our own staff, but also for the wider workforce. And I do think, coming right back to the beginning of the conversation, Ray was talking about what data have we got. If we haven't got the data to show what need we're going to be matching, what the outcomes are going to be, have we got a baseline to measure, that is really tricky. So I think for all of these things, if we've got a need for an innovation, we know it's going to take ages, we're tenacious, we'll get it done. We also have to have that baseline data. And WorkPal offers that in a staffing context for the workforce, that we need to sort of look across the wider workforce. And Claire talked about the digital upskilling for the actual digital hands-on professionals, and I think that's going to be a really good program. I sat in a round table about that probably about a month ago, and they were saying we need 10,000 new people, but if we look at attrition, because people move to the private sector because they can double the pay, it's like 17,000 staff that we need to bring in to fulfill the needs of this agenda. And they were looking at all sorts of things like internships, apprenticeships, how do we improve pay and conditions. So as a profession as well, we can sort of help with that recruitment, can't we, to overcome those barriers to having data, having competence and capability in the organisation, and really getting this moving.
Thanks, Liz. I wonder whether we could just what your thoughts are as in terms of some of the in terms of the accessibility agenda around digital, in terms of digital literacy, accessibility, in terms of kind of hardware, as well as the broader agenda. What are your thoughts around that? I think Claire's gone.
Do you want me to kick off on this, Hannah?
Yeah, go for it, Liz. Yeah.
So at the moment, one of the consultancy assignments I'm working on is the digital strategy and underpinning infrastructure for Cambridgeshire and Peterborough ICS, and working with them. And I chair, as I said, I chair an integrated care place in West Yorkshire as well. And there's quite a lot of resources that if you've got patients, residents, service users coming in, that you can signpost them to. If there's somebody who wants to be digitally literate, libraries will run courses, community centres. There's quite a lot of infrastructure out in communities, and also a lot of trusts are developing digital champions. I think somebody talked about that earlier, to support residents and patients. Primary care have had funding for digital champions to upskill the staff in primary care centres, but also residents who come in who are struggling. There's somebody that can sit down with them and talk about that. And I think we can do the same for staff, can't we? If we're in an organisation, we've got people who are coming forward who are really not confident, that want to embrace digital, we can provide that within the organisation. We've probably got enough people who can support other people. And I think it was Claire talking about digital champions, or I don't know who it was now, but somebody did say that, you know, Janet, was it you, setting up a range of digital champions so we can help our own workforce. But I do think this is more difficult if we've got people who really won't use it for whatever reason. You know, maybe they've got sort of ethical objections and they won't use it. And also for those people that can't use it, maybe because of illness or just age-related conditions, can't use an app, can't go online. We need to make that provision. So we've got external, we've got different sources.
I mean, we're just doing a piece of scoping work at the moment in terms of, as I said, building the organisation and identifying what good practice there is out there, yeah, that we could replicate. And when for an ICB, it's a somewhat different challenge than it might be for a provider organisation. Obviously, I've worked in both. I mean, our staff are not frontline. You know, most of them are home-based or hybrid working at the moment now. So there's less. There's more digital literacy than perhaps there would be in other groups of staff. Yeah.
I think there's something around digital literacy. Definitely, we wrote an article for HPMA, I think it must be 12 months ago now that we did this. But there's also digital poverty, especially in the cost of living crisis. So it was estimated to go up from somewhere like 7% to 11% in the year that's just passed. So there'll be a bit of that going on as well. I think in terms of accessibility, having lived this experience as well, working with clients who absolutely rightly insist on all members of staff being treated equal, and so therefore accessibility. The irony is there are digital products out there that are specifically designed to cater for accessibility of all the products. So we're living in this kind of fast-moving world where there's so much generation of innovation and ideas. And as our friend, I think it was Rich in the chat has already said, he's been on ChatGPT and done something like that. It really is fast-moving, which is frightening, but also extremely exciting in terms of the opportunity that it gives. But yeah, accessibility it should be paid attention to, but there are things happening in that arena.
That's great, thank you. I'm just going to pull out a couple of the questions and the feedback that's coming through. So I'm reading this live. So Olivia said, in terms of overcoming barriers, I hear a lot that people wish they'd been consulted, asked, etc. So they feel like we're all moving forward together. We need a culture of moving forward together rather than the implementation of new processes being something that is done to our workforce rather than with our workforce. It'd be really great to hear your thoughts on this. I think the first thing that came to my mind is around human-centered design and how we use that as part of the way that we think about how we redesign our processes, very much from the experience of the person that's working within that process at the moment, and will work within a digital process in the future. So what are your thoughts around that?
Completely agree. As I think I've made clear, I am no expert. Liz and Claire have got far more technical knowledge on this than I have, but yeah, and it's always a challenge, isn't it? How do you engage the people that are reluctant to do that from the beginning in helping to design? So yeah, it's an ongoing challenge, isn't it? I mean, and then that's about not the technical ability of the systems, because we all know there are all singing, all dancing systems out there. It's about the OD elements of that and how we actually help people to use them to best effect. So and I think, you know, we, in my 37 years experience, we have got IT now. So, you know, I have learned things. I think I had one training session back in the early 90s. That was it. But I think, you know, we just have to focus on the cultural elements of putting them in. It's not just about a new system. You know, you might get the technical training, but how does it change the way we work? And I think, as Ray was saying earlier, it's not just about replicating what we do ourselves in a digital way. It's actually about doing things really differently. And you've got to have staff involvement in that, but you know, accept that it's always going to be a challenge.
And I will completely agree with that. Claire, do you want to come in? You'll come in first.
No, you go first.
Okay. I was going to completely agree. I was coming in at the same time as Janet to say this is like any other big project that we're running, engaging people, finding out where they're at, helping them to design the process, as you said, Hannah, and then continually communicating where we're up to, what comments have you got, how can we make life easier for you? Because this is all about meeting, putting a digital process in place should be about meeting the needs of your residents or your staff. So how do we do that best suits you and really bring people on board with that? And the people who are sort of shouting in maybe seem like detractors, look at what they're saying, think about, oh, actually, are they saying because it's not going to fit, it's not going to work, how do I take that on board as well and build that in? Or if you can't take it on board, you know, explain to them why. And everybody knows all this, you know, you're all professionals, but just keep them engaged and keep communicating. And throughout the rollout, rollout and the evaluation, just keep everybody informed and consulted on what's going on.
I completely agree with Janet and Liz. You need to take people with you right from the start of the journey. Right, you know, what are the principles right at the beginning? Engage with your, you know, customers, staff, get them all in a room. And I would also include staff side, because I've had to do some really challenging change processes in the past, and they've been made much easier because I've had staff side included right from the outset, and so they're part of the design of the future. And so I would really recommend that approach. And it is around a cultural shift. And I'm sorry again to mention the Futures programme, but part of our people services transformation, we're trying to create a number of tools for you, as I've already mentioned, but also part of it is a programme around culture change and transformation. So people will be able to access some of that. And again, we'll be putting that, and I've put the link, hopefully, I was putting the link in when I obviously left the room. So we're no good at multitasking, but so we recognise that that's a really important element, and getting people in a room, co-designing is, I think, the most important thing that you can do.
Thanks, Olivia, for that question. I think it's really prompted a good discussion, but I was actually going to ask Ray, do you want to come in? Because
yeah, thanks. Yeah. So you can see I'm chomping at the bit on this one as much as. So full disclosure, it's the mistake I made. So when we built the tech for our product, it was great tech, isn't it? Exciting. Let's put it in. And it paid away near as much attention as we should have done to the change process that sits underneath that, the people-led tech. And that was costly both in terms of time, money, and maybe even a bit of reputation in the early days. But we got that wrong. Glad to say we got it right now. But Hannah will smile at this because we position our product as not the digital product is just a thing. The key thing here is the change process, the fundamental culture change process that it underpins. It just happens the digital stuff is really helpful when you get it into as a continuous change cycle. Because at the end of the day, as you all know through again AI and everything you see on the news, technology is not standing still. So it needs a change program, which is definitely a kind of a lift off, if you like. But then you do need these change champions, speaking to, I think, Janet and Claire's point before, to continually pay attention to the evolving world of tech and how is that going to impact on what you built. You know, it's a continually changing cycle. And to that end, again, through Hannah, I'm giving Hannah a lot of shouts out tonight. Through Hannah, we work close with our clients to horizon scan and get people in the room like staff side, like exec. And we also do we've also done academic studies on the work to make sure that, you know, if we are doing a piece of work, how is the piece of work through our work impacting on things like patient outcomes and experience? How are we tracking that through? Again, digital is allowing us to do these things now, which gives us more credibility. So continually changing feast needs paying attention, and it's all about change and less about the digital, I think is what I would say.
Really helpful. I'm just reading the chat at the same time. Okay, so I'm conscious of the time, and I would really like to kind of open it up to a Q&A so that we can see kind of what people's thoughts are and what would be most helpful for people before we finish the session. Just in terms of kind of, I guess, kind of just closing this part of it off. Claire, you have, I really don't think you should apologise to doing shout out for all the work that you're doing. This is the stuff that's really going to help people to be able to move this agenda forward. But if I could ask each of you to maybe give one piece of advice, or what would you want to kind of leave people with in terms of thinking about this agenda and what will be a helpful next best step around this?
So I would sort of look at, you know, don't be overly ambitious, I think. And I think our colleagues have said that is, you know, start small, look at potentially one of your areas. You know, lots of people have mentioned recruitment. So potentially look at starting with your recruitment processes. And as we've also said, don't just get the HR team to sit in a room. Bring in your colleagues, your staff, even, you know, external groups to actually look at where the issues are, where the potential benefits. Obviously, I've mentioned some tools that can help you, but sort of that co-design and look at what, and don't reinvent the wheel. I think Janet mentioned this is, you know, lots of people have already done this. Rawfree is a really good example. They've got lots of already available RPAs. So don't reinvent the wheel, but also don't just pick up and use what other people have done without actually making sure that it fits your organization. I think is probably what I would say. And do sort of engage with the Futures team. I've put Pete's email in there as well. And if you know, we're happy, we've run some workshops with some systems to start looking at some of their sort of functions and potentially how they could change or how people can collaborate from different providers. So we're also happy to have those conversations with systems to help some of that conversation.
I suppose mine would be slightly different, slightly more simple, I suppose, but identify champions. So you need to have champions in your exec team. You need to have champions in your recruitment team. So make sure that you've got those champions identified and kind of let off the leash. And then I would say, you know, whilst I recognise, you know, cutting the elephant into bite-sized chunks, it is good to have ambition. And I think, you know, we should support those people in our team who have got the ambition and the vision.
Janet, sorry, I'm going to just jump in. I absolutely agree. And what I should have said was as well is really make friends with your CIOs. We've started working with a number of systems to develop that vision that Janet's talking about. We did it in Lancashire, Derbyshire and Devon. And it's the first time I've ever seen CPOs, CIOs and CFOs in a room. And obviously, you know, when we're talking about trying to get the people digital up the agenda, if you can get your CFOs and CIOs on board with this vision, as Janet has mentioned, in terms of your board, it helps make our case a lot better. But it is setting that vision and then having plans year 1, 2, 3, 5 about what you can achieve.
Can I hop in there, Hannah, on having a plan? So I was sort of thinking, if you're probably going to need you're going to need some funding for your innovation. So I would say, if you're making a plan to exec team or board or wherever it needs to go, think about what the outcome is going to be of the digital product innovation service that you're going to put in place. So how is it going to support staff? How is it going to support patients or service users? Think about the value it adds. Is it going to cut costs over time? Will you need a bit of pump priming, but over time it's going to cut costs, or will it keep costs the same but give a much better outcome? Think about how it meets the need of your staff or patients or service users. And also think about how you can build those networks. So Claire's talked about work going on in other systems. Can you buddy up with another system to help with it? Can you form networks in your organisation so you can show that you're bringing knowledge into it to support your organisation? And I think on that, we've talked a lot about the, you know, sort of small steps. And I would, was a really nice sort of little phrase around this, which is think big. So as Claire said, have that aspiration, have that long-term plan. Start small, measure as you're going along, look at where the barriers are, bring somebody in like Hannah who works a work pal, if it's that sort of product, to work with you, and to look at how you start small and get the ground rules in place, and then scale fast. So you get your program going where you know it can work, start scaling fast across people in your organisation, because they'll start to become aware of it and start to become enthusiastic about it.
For me, again, I'll probably state my you know, gamekeeper turned poacher kind of thing, but our lived experience across the last 6 years doing this is exactly what the panel have said, in terms of building the relationships with those who are required and need the expertise and support in order to make these things happen. It's to start the conversations in your organisations and systems, and also obviously a plug for these events through HPMA. Please continue to come, because we want to grow the conversation, hopefully, as we go forward. And I know you've got regional things planned as well, Hannah. There'll be less of us talking and more of a collaboration of us all kind of getting going on this, but please do talk. But a slight vignette I'll give you, which is a kind of, you know, once you've spent as long doing this as we have an NHS organisation that's audit and finance driven alone. That's all they do. On the back of the work we did with them on the people function, we've now been invited to, as a free slot and a free exhibition stand, to present at HFMA, the Finance Managers Association, because they see the link between what we can do with the people agenda and how that turns into pounds and pence for the organisation. And that's a very small thing, but it took us probably 6 years to get that, Hannah. However, it's by having the conversations and continually being persistent. Like Liz says, we're a tenacious bunch, the people managers in the NHS, by being tenacious and having those conversations and building those relationships and building that future together and then planning. It is possible.
That's great, thank you. So I'm just going to open it up. So if we've got about 5 to 10 minutes. Are there any burning questions that anyone has? Please just unmute yourself and ask away. Clearly given so much insight as a panel. Okay, that's fine. What we will, Joe has, as you said, recorded the session. So Joe, would that be circulated at the end? Not sure whether she's in the background or not. We'll make sure that we communicate how that would be circulated and how that will be made available, obviously for people who weren't able to attend. If there's any other questions that people have, then please feel free to send them over. I'm going to pop my my email in the chat box, and you can send them over directly to me. As Ray said, we're really keen to keep this conversation going, and we're very much wanting to be led by the community around what will be most useful. So hopefully this has been a good starting point and started to be a stimulus around the digital workforce agenda. But if there's anything particular that you want us to focus on as we move forward, this is a 12-month programme, so we're really keen for that it adds as much value as possible, and we're going to continue to do these types of webinars where we focus more on kind of some of the kind of this big strategic type of issues, and I'm sure we'll be inviting Claire along regularly to give some updates and some insight about what's happening at that national level, but also some more kind of tactical operational content as well that will allow us to really kind of get into kind of some of the what can we actually do in order to be able to move this forward, and what are some of the tools that we can start to explore. So please do feel free to just utilize my email. Feel free to kind of send me any of those kind of questions, thoughts and feedback. But unless there is anything else, then we'll draw this to a close. But a massive thank you to Ray, Liz, Janet and Claire for joining us and sharing your insight, your expertise, and doing that in a very generous and empathic way. So thank you ever so much, and we'll make sure that we share the recording as soon as we can.
Thank you. Thanks, Hannah.
Thanks all. Take care. Enjoy your long weekend.
Thank you.
Take care.
Thank you, everybody.
Bye.